welcome to the Deep Dive.
Glad to be here.
Today, we're really getting into a crucial aspect of reconstructive surgery. Specifically, what happens when tissue grafts and flaps, the body's own repair materials, essentially run into trouble?
Yeah, when they become compromised. We've been digging into a review article that pulls together a lot of research on this. It looks at how a particular therapy might actually help save these tissues.
Right. So our mission today is to understand why these tissues can fail sometimes and how this treatment, hyperbaric oxygen therapy, seems to offer a lifeline, according to the evidence we've seen. And this is really for you, the listener, especially if reconstructive surgery is something you or someone you care about is facing.
Definitely relevant stuff.
Okay, so let's break it down. Grafts and flaps. Surgeons use these to move healthy tissue to fix an area that needs repair, right?
Exactly. A graft might be, say, mostly skin. A flap is often chunkier. It can include skin, fat, muscle, sometimes its own blood vessels. It's living tissue being moved.
Amazing stuff. But the key is, it needs to take in the new spot.
It absolutely needs a good blood supply, oxygen, nutrients, everything it needs to live. And sometimes, well, that supply just isn't good enough.
And that's when we call it compromised.
Compromised. The source points to different reasons this can happen. Maybe the initial injury was really bad.
Or infection gets in.
Infection, definitely.
Right.
Or maybe there's scar tissue from before, or the area had radiation treatment, which can damage those tiny blood vessels over time.
So the plumbing, the blood flow gets messed up.
Yeah, basically. And it's like that analogy we discussed, the newly planted tree.
Oh, right, if it doesn't get water.
It wilts fast. Same with tissues starved of oxygen. It starts to die, and you're really in a race to save it.
So if the problem is lack of oxygen because the blood flow is bad, how does hyperbaric oxygen therapy step in? It sounds pretty intense. Pure oxygen, high pressure.
It is a bit, yeah. You go inside a special chamber. The air pressure inside is pushed higher than normal atmospheric pressure. And while you're in there, you breathe 100% pure oxygen.
Okay. Why the high pressure?
Well, that's the clever part. The increased pressure allows your blood plasma, the liquid part of your blood, to absorb much more oxygen than it normally could.
Ah, okay, so it's not just about the oxygen hitching a ride on red blood cells.
Exactly. Even if the red blood cells are having trouble squeezing through damaged or swollen vessels, this extra oxygen dissolved directly in the plasma can still get delivered to those struggling tissues.
It's like finding a detour for the oxygen delivery.
Kind of, yeah.
Yeah.
You're basically flooding the zone with oxygen that can reach places it couldn't easily get to before. Think about that wilting tree again. It's like giving it super oxygenated water right to the struggling roots.
Makes sense.
Yeah.
So what does the research, the evidence compiled in this review, actually say? Does it work for these compromised grafts and flaps?
Well, the source looks at a range of studies. First, there were animal studies. Those generally showed pretty positive results, better survival rates for different kinds of flaps when they used the therapy.
Okay, animal studies are one thing. What about in people?
Right. So the review breaks down the human studies based on the strength of the evidence, how the studies were designed. They talk about class 1 studies.
These are the best quality, right, like randomized trials.
Exactly, the gold standard. You compare patients getting the therapy against a similar group, the controls who don't get it, ideally randomly assigned. And the review mentions a class 1 study that found significantly better graft survival in the group that got the hyperbaric oxygen.
Significant improvement. That's pretty compelling.
It is. Then there are class 2 studies. The source mentions some showing, for instance, less tissue dying off in patients who had compromised tissues because of trauma when they used the therapy.
Okay. And what about class 4? I think that was mentioned too.
Yeah, class 4 evidence often includes things like case reports. So these are detailed stories about individual patients.
Like, here's someone who had a really bad injury, complex surgery, the flap started failing, we used the therapy, and it was saved.
Precisely. They can be really illustrative, showing the potential in tough situations. But, a single case doesn't prove it works for everyone.
Right. It's not the same statistical power as a big trial.
No, definitely not. But when you look at the whole picture presented in the source, the animal data, the class 1 and 2 studies, plus these class 4 examples, the overall suggestion is that, yeah, there seems to be a real benefit. It helps improve the odds for these struggling tissues.
And timing is key, I gather. The source really stressed starting it quickly.
Absolutely. The sooner you start the therapy after identifying the compromise, the better the chances of success seem to be, based on the research reviewed. And of course, you have to select the right patients it's used when the reason for the compromise suggests oxygen is the main issue and the therapy could help.
So this is where it comes back to you, the listener. If reconstructive surgery is on the table, or if complications arise, knowing about hyperbaric oxygen therapy as a potential tool, well, it means you can ask informed questions.
Exactly. It can be part of the conversation with the medical team about options if things get difficult.
And the potential benefit is huge, right?
Yeah.
The source talks about avoiding more surgeries.
Yeah, saving that initial graft or flap means potentially avoiding repeat operations. That's less physical stress, less emotional turmoil, and frankly, often saves on healthcare costs too. It's a big deal.
So wrapping this up, when the body's incredible healing ability hits a roadblock, specifically with these vital grafts and flaps not getting enough oxygen, hyperbaric oxygen therapy looks like a really important tool, supported by the evidence we've discussed, to give that tissue the boost it needs.
It really does. And what gets me thinking is, if simply optimizing oxygen delivery under pressure can make this much difference for tissue survival when blood flow is poor,
Yeah.
well, it just makes you wonder what other healing processes, what other situations where tissue health is compromised could potentially be improved if we found better ways to enhance oxygen delivery right down at the cellular level.
It's a fascinating question. A lot to think about there. How focusing on something as fundamental as oxygen might open up new therapeutic avenues when tissues are really under stress.